Right now I'd like to talk about deep neck stabilizers. Now there's a lot of work out there that it's shown that if you can help strengthen those deep neck stabilizing muscles, that can help dissipate the forces that run concurrently with impacts that have shown to cause concussions. Now I am not in any means saying that you can prevent concussions, but what I am saying is that anecdotally, this program that we have produced here has helped minimize the amount of games that we have lost for our athletes as a result of suffering concussions. There's a lot of training ideologies out there when it comes to training the neck. Now the traditional football model shows us that bigger, stronger muscles are the way to go. So like you would train a squat or a bench press, the four-way neck machine, the halos that attach to the weight plates, manual resistance, these are all exercises designed to hypertrophy the muscles of the neck. Now, if you follow the training ideology of Mike Boyle and his colleagues of every other joint of the body having to either be mobile or stable, working up from the ankle, you'll see that sort of ideology doesn't necessarily work with that traditional football model. So starting with the ankle has to be mobile, the knee has to be stable, the hip has to be mobile, the lower back has to be stable, the upper back has to be mobile, and then obviously the next in line is the neck has to be stable. So stabilizing those muscles in that philosophy shows that in order for the body to work efficiently, that's the next step.
The first exercise in this series is a simple neck plank. Start with the ball at eye level and put the forehead onto the ball, utilizing the neck muscles to stabilize the body. The next exercise involves rotating the head back and forth while maintaining contact with the ball in the same plank position. The third exercise involves moving the head up and down in the same position, maintaining contact with the ball throughout the exercise. The next phase of this exercise involves doing the same three movements, beginning with the neck plank, then transitioning to side, and finally transitioning to up and down, only with the ball a little lower to the ground. Start with either chest height or go as low as waist height. The last phase of this series involves moving the ball right to the ground. You can begin on your knees and then move to your feet, doing the same three movements, beginning with the plank, then transitioning from side to side, and finally to up and down.
This next exercise is designed to be performed post-concussion. Now studies have shown that after suffering a concussion, the deep stabilizing muscles in the neck will begin to atrophy. That leads to the likelihood of a second concussion or a third concussion happening later on down the road. These exercises will help to stimulate those muscles to begin strengthening so that the likelihood of a second or third concussion happening gets reduced greatly.
This exercise is very simply done. First, lay down flat on your back. Next, pack your chin as if you're looking at a spot on your shirt. Then, lift your head up off the table while maintaining a packed chin. Hold it for the desired time, and then slowly lower it back down. Get a full recovery before beginning the next rep.